Hello and welcome back to Study More Hygiene. Today's video I want to be talking about oral hygiene instruction for patients. And the first thing that I like to talk about is the plaque/calculus cycle. So when we're talking about plaque, in everybody's mouth, every 12 hours a biofilm adheres to the teeth every 12 hours, and that's full of different bacteria. And the point of this is every 12 hours, we recommend you brush. So that's where our brushing 2 times a day, every day comes from. It comes from removing that plaque biofilm every 12 hours that it does appear. So as we cleanse away that bacteria every 12 hours, we keep a healthy mouth. Nothing's going on. Gum tissue pocketing stays healthy. Gum tissue stays nice, pink, coral color, stippleting. And patients usually don't have any issues if they keep up with their brushing and their flossing. And that flossing actually helps to massage the gum tissue to keep it taut, to keep seals around all those teeth, preventing any bacteria from getting underneath the gum tissue. Now, once, I'll show you here on my board. So again, we can see we have healthy gum tissue. There is no redness. It's nice and pink. The bone levels around those teeth that keep the tooth in place are nice and high. The periodontal ligaments are all intact. And yes, this is a healthy person's mouth. So once somebody starts to lose their daily habits of brushing 2 times a day, every day, flossing every day to keep that gum tissue taut, and they start skipping days, or they do it once a day, patients start to notice redness appearing in that gum tissue. So we have our picture here, so we can see again another healthy model. Our bone's still intact. Now let's look at the gum tissue that, or we call gingivitis. As you can see, our gum tissue's red, inflamed. When we go in there and measure that gum tissue, definitely there'll be some bleeding going on. But again, all the periodontal ligaments are still intact. All the bone is still intact. So there's just a little bit of bacteria getting caught in that pocket, causing that redness, infection. And this can be reversible. It can be reversible by getting that toothbrushing back to 2 times a day, getting that floss in there to cleanse out that area. And over time, if you get back to those good habits, 1 week, 2 weeks, 3 weeks, that gum tissue will start to return to that healthy looking pink color. There won't be any bleeding. And then again, if that patient proceeds down the same path, they keep with those bad habits, they're not brushing, they're not flossing, this can progress past this point. So let's go into our early periodontitis. So at this point, the patient wasn't taking care of that bacteria. You can see that bacteria started to eat away at that periodontal ligament. That infection has continued to progress. The bone levels have actually taken a hit as well. So they started to deteriorate due to that infection. And that's the body's natural response to remove that infection. So all those periodontal ligaments are starting to break away. The bone is deteriorating. Our gum tissue pocket is actually getting deeper. So if we go back to our previous page, our healthy pocket, we're about 2 millimeters when we measure that gum tissue pocket. In gingivitis, again, it's still at that 2 to 3 millimeter range. And now with that early periodontitis, we're getting into that 4, 5, 6 millimeter pocket range. So, and we're having buildup on the physical tooth, calculus buildup. And that's just bacteria and plaque that wasn't removed, and it's solidified over time. So then once that bone is deteriorated, we're not getting that bone back, is the important part from the periodontal aspect. Even at this point, if the patient decided to pick up those good habits of brushing every day, twice a day, flossing, at this point they would need to use a water pick to get into that deeper pocket, because the toothbrush won't get all the way down in there, floss won't get down all the way in there to cleanse that pocket. We can get rid of that redness, that swelling, that irritation. Those ligaments potentially could reattach to some degree, but that bone, once it's gone, it's gone. And then again, if this patient decides not to take care of this issue, we proceed from early periodontitis to moderate periodontitis. So again, that pocket depth has stayed the same, but even more periodontal ligament damage has occurred, even more calculus buildup that's going underneath the gum tissue that will cause even more redness, inflammation, and infection. Lots of bleeding will happen, more chance for bacteria to get caught in this gum tissue pocket, and we can see the progress of that bone has even deteriorated more. So at this point, this person is in a tougher situation to clean out that pocket. They would need to come in more often to the dental office every 3 to 4 months to take care of that buildup, or to take care of that gum tissue pocket to cleanse it out. And then we would have to see this person for a scaling and root plating or an SRP to remove that deeper plaque and calculus. And again, this patient's having more chance of every day they leave it, there's more bone deterioration, more chance for this tooth to start becoming mobile, and potential to exfoliate or fall out. So now when we go into the advanced periodontal disease, now this pocket has progressed very far. So now we're talking about a 10 millimeter pocket when we measure that gum tissue. And a good 2/3 of that bone has been deteriorated. The periodontal ligament is pretty deteriorated. If you imagine it on both sides, this tooth would be very mobile. There's a large amount of buildup calculus subgingivally. And we can see here a lot of that underlying bone that should be there is being removed. And again, this person potentially would have to see, instead of a general dentist and a dental hygienist, they would have to see the periodontist to cleanse out this area to start, and then progressive treatments to take care of things. Again, and we can see all the redness in that gum tissue. The periodontal ligament is almost gone, so there's nothing really holding this tooth in there, or there's barely anything holding this tooth in there. Very high chance, likelihood of this tooth to come out. And even to save it, you would remove the tooth and potentially place an implant if there was enough bone, if we can arrest this disease. Again, we would have to use our water pick to cleanse out this area. You would need very professional cleanings very often to cleanse the area, remove all this big buildup. But yeah, once this bone is lost, it's lost. We can't get it back. Same with the periodontal ligament. At this point, that periodontal ligament has pretty much been removed.